Hi everyone, I really appreciate you all coming over and meeting with me to talk about the topic of early intervention to early childhood transition. You know, as a parent of a child that has disabilities, I had a lot of questions regarding this process of transition from early intervention to early childhood. And in my working with families, I see a lot of families who also have a lot of very important concerns, a lot of questions that they have. And so I thought this would be a good opportunity to ask these questions and get some input from your variety of perspectives. So I brought some questions with me, and hopefully we can get through them and see what you've got to say.
Great.
Sounds good? All right, thank you. So I'm going to start off, I think, with some general questions just to kind of open the door here. So my first question that I know I had at the time, and I know a lot of the families have, is what is the difference really between early intervention and early childhood special education?
I think I'll take that to start. Coming from early intervention, the concept is that we work directly with the families and caretakers of the children to help with their developmental needs. Our goal is to help that parent be the advocate for their child, to understand their child's disability or developmental delay, and to help that child progress until they do transition to the early childhood system.
And early childhood special education is really school focused and student level focused, to where the whole plan for the child centers around what's going to make them successful in the school environment. So what's the impact for school? What makes it more difficult for them to socialize with their peers or learn? And what can we do to make that easier?
Okay. There is a difference then between the two programs. So when a child enters into early intervention, into early childhood, pardon me, are there any costs into early childhood?
No, all students who receive an individualized education plan, they receive a free and appropriate education, so there are no costs associated with receiving programming.
Mm-hmm. Are there any costs at all though? I know like when my other children who've gone through school, there's registration and things like that. Are there other costs like that?
It will depend upon what program your child attends. If they're attending a private preschool, of course there's a tuition associated with that. If they're attending one of the Preschool for All programs, there would not be a fee with that. But some school districts may have a registration fee associated with their individual preschool program.
Okay, so there is a little bit of funds that, that do have to.
Quite possibly, and it just would vary across the state and what program you're in.
Okay. Are there other documents or anything else that we need when our child goes through this process and for school?
Yes, it's just like when any child enrolls in a public school system, they will need to have basic items like the certified birth certificate. That's that one that has the seal from the government on there.
Not the pretty one.
The pretty one with the baby's footprints on it. They will need proof of immunizations. They will have to have a school physical and a lead screening. Those are just some of those basics that they will have to have.
Okay, all right. One of the concerns I know I had as a parent was my son's birthday was in June and he received early intervention services, and I was concerned that he would have a gap in services because school started in the fall. Is that a concern? I mean, it is a concern that parents have. Should that be a concern?
Well, for a child that's in early intervention and they are going through that transition process, we are mandated to have the eligibility determined and the IEP in place by their 3rd birthday, no matter when that falls. So at a minimum, those special services like PT or OT or speech, those would start on the child's 3rd birthday. However, that again may be during the summer, and we would have to take a look at whether or not that child qualifies for extended school year services. Otherwise, they can get those services at any time. I do want to let parents know, though, that if your child turns 3 during the school year, again, they will automatically get those special services when they are found eligible for those, but a preschool program that they are interested in attending may be full at that time. That's why we like to work with families in this transition process to kind of take a look at where they might be interested in their child attending.
Okay, you mentioned preschool, so as a parent, do I have an opportunity to look at these different places that our child might be able to go?
Absolutely. You should be working with someone throughout this transition process. The school district should have sent someone to the transition planning conference, and you could talk to that person about visiting the preschool programs. If you have dealt with multiple people at the school district level, I would maybe contact the building principal to see if they could set that up for you.
Okay, okay.
And it is a good idea to go and observe the different classrooms because, again, the parent is a part of that IEP team, and I think that just seeing the settings and knowing what the different options are really helps that parent become, a true part and informed part of that team.
Absolutely. I always tell parents, I think when you walk into that classroom setting, you get a feeling of, oh my gosh, this is perfect for my child, or I'm just not sure this is going to work out quite right. And that helps them to know when we're sitting around the table and talking about those options, they can at least visualize what we're talking about.
Absolutely.
That's so true because I remember the first time we walked into our son's special education classroom, and it was not what I envisioned. It was just fun. It just looked like such a fun environment, and I wanted him to go there.
Well, a lot of parents have so much anxiety about this time of transition, and I want them to be comfortable and to be able to visualize where their child is all day, every day, and to know what's going on in that classroom.
Yeah, that's very appreciative. I'm kind of going to move a little bit to some more specific questions about eligibility. And so one of the first questions that I have is, how is our child's eligibility determined for early childhood special education? Because I know in early intervention, my son had a diagnosis, and so he was automatically eligible.
We work very closely together. The team in early intervention would have determined their early intervention eligibility, as you said, and we provide all that information at the transition planning conference to the school district to determine whether that's useful or not as part of their process.
Right, and the identification process is a little bit different for early childhood special education. You mentioned your son having a diagnosis. A diagnosis does not automatically enter you into early childhood special education or qualify you for it. Obviously, that's something that's looked at, but ultimately it has to go back to, is there an educational impact or an academic impact? And that's also social, that includes social, emotional skills as well. Is there a social impact, emotional impact on the education setting? So the evaluation process, the team meets together, the parent is a part of the team, you'll likely see a special education teacher, a local education agency representative, which is oftentimes an administrator from the district, and any therapies that may be involved, also probably a social worker and a psychologist from the school perspective. And everyone meets together to talk about what information is known about that child, to where they're really looking at that early intervention referral packet and talking to the parent about what's known. And then they talk about what else, what other information do they want. So then that starts the evaluation process, and the team looks at all of those different areas, or several different areas, and they come back together and report out all of the evaluation results.
Christy, I think that's important that you mentioned that educational impact and meeting the eligibility criteria through the school district, because I know I have worked with families in the past that they have a child who maybe has a diagnosis of autism that they receive from a developmental pediatrician. And when we look at that through the school district, we have to be sure they're meeting that educational criteria to receive a category of eligibility of autism. And sometimes that is different from the medical diagnosis. Right. So a child may have that diagnosis, but then not meet that category of eligibility through the school district.
So I think the information that I want to take from this too is that just because my child is eligible for early intervention doesn't necessarily mean they're going to be eligible for school.
Correct. Absolutely, yes.
Okay, all right. So Christy had said that if my child did need additional evaluations, like through physical therapy or school social worker or whatever, if he does need those, where are these evaluations done at? Because I know in early intervention, they came to my house.
Correct. Early intervention does provide a lot of those services in that natural environment, and we tend to switch over to a school-based environment once that child is getting closer to the age of 3. So oftentimes that evaluation will occur at the local school. It might be at a child care center that child is already attending, or another private preschool. It depends upon your local school district, what space they have available and what they use. Some schools have designated rooms that they use for evaluations only, so they can do a play-based assessment with the child. Others may have a very small room with a little table and chair that they're using. It would just depend. So you need to ask your local transition coordinator, and they can describe that setting for you in a little more detail.
Would I be, as a parent, would I be in the room? Or am
Absolutely.
I separate, we're observing, in a separate way?
Parents are a part of that evaluation process. I mean, who knows the child better than you do? And so, of course, we want to use parents' information in that evaluation process. Sometimes it's in an interview format. Sometimes it may be you actually doing some of the play-based activities with the child.
And whether or not the parent is in the room, that probably varies from child to child and district to district, just on how that evaluation process is set up.
As I know, for some parents, when their child's in a strange setting, they shut down. And so, having the parent be in there can sometimes, I would think, make that a little bit easier. So
That would be important to kind of relay that information during that initial meeting whenever you're talking about what's known about the child.
Oh, that's okay.
So the
That's
team,
good to know.
is aware of that.
Awesome. Okay. When these evaluations are done, as a parent, will I have an opportunity to look at these reports beforehand, before we have the meeting?
That also is a question for your school district, but yes, you have the ability to look at those reports. You can request them. Everything really is in draft form before that meeting because there's no predetermination. However, reading through those reports will help you because there's a lot of information coming to you at that meeting. So I think it's definitely helpful to process that information prior to the day of.
Okay. Okay. When will I know if my child is going to be eligible for early childhood special ed?
That comes at that second meeting whenever all of the evaluation information is shared out. After that information is shared, towards the close of the meeting, eligibility is discussed. And Cindy had mentioned those different categories and eligibility criteria. There are 13 different eligibility categories, and you won't go through every single one of those, but definitely the ones that are possibilities or most relate to the child would be discussed. Some common ones for early childhood would be a developmental delay or speech and language impairment, autism. I think those are the ones that are seen most frequently at this age.
So as a parent, I shouldn't be looking for a letter and say, "Woo, your child's eligible." So this is all done in a meeting.
Yep, that you're a part of.
Kind of like our IFSP meetings, but a little different.
Right.
Okay. All right. Who will be at this IEP meeting, the Individualized Education Program meeting?
Anyone who is a part of that evaluation will be there. So similar to that first meeting when everybody meets to talk about what's known about the child, there'll be the school psychologist, the school social worker, a special education teacher, a general education teacher, speech pathologist, anybody who is needed. There's a lot of people there, and I think it can be very overwhelming just walking into a room with all of those people sitting around a table.
And as a parent, you have the right to have your early intervention therapist
Right.
invited to that meeting as well. They can bring that history and that practice they've been using on that child already to that meeting to help the special education programs kind of get a good picture.
Can I bring other people as well?
Yes, you can.
Whoever you like.
Okay.
I just encourage parents when they anticipate bringing others to let the school district know in advance. Some of the rooms that we have meetings in aren't very large, and I want to be sure that we have proper space and seating for them. I don't want them to feel bad walking into the room and all of a sudden we don't have enough chairs. So if they would just as a courtesy let the district know in advance, that would be great.
Okay. I do remember when we had our first IEP meeting that there were quite a few people in that room. So, and it was a little overwhelming for me as the parent because, I may have met some of those folks once, and maybe some of them not at all.
Right.
So even just kind of figuring out who's doing what was a little bit of a challenge. So
I think that's another important reason for those early intervention providers to be there. Not only have they been working with those children, but with the families. And the parents feel very comfortable having them there as a resource and, just kind of a support system so that they know that the information is going back and forth in a timely manner and everyone knows the details about the child, and just to help make that family feel better.
okay, wonderful, wonderful. So it sounds like there's a lot of people at these meetings, but it also sounds like there's a lot of meetings. So can you just go over that real quick, how many meetings there are and what each one does?
Sure, that's a good question. It's important to be comfortable with the people you invite, but also, like you said, to understand all these different meetings you have to go to. For a child who's in early intervention preparing for transition, we're going to have a transition planning conference meeting, and that's where we try to pull the school district along with the EI therapists and your early intervention team, the parents, the caretakers, to start talking about what transition means for your child and introduce them to the school district so they have that comfort level and understanding about what the potential is for the special education programs.
So that would be the first time I'd meet someone from the school district?
Yes.
Okay, okay.
And then the next meeting would be the domain meeting, and that is where the team talks about what is known about the child and what information is needed. And that's also where the parent will give consent for the evaluation.
Okay, okay.
After that, you move into the eligibility determination conference, or the EDC, and that's where all of the evaluation information is discussed and you determine eligibility. That meeting is often paired with the individualized education plan meeting, the IEP, where then the services are talked about and goals, minutes, more of the details about what's needed for the child.
Okay, all right. So kind of a follow-up question to that though, some families have a hard time taking off work to go to all these meetings. Is that a problem if they can't go to a meeting?
We try to combine as many as we can based on the schedules of all the people involved. Best practice would be that you have ample time to understand everything that's being discussed, have time to think about that with your other partners, your family, other caretakers. But understanding in today's society, it is difficult sometimes to have all that. We try to go with what's best for that child and family and the team. Anybody you want to have there. Can they all meet different times? If not, what can we combine to make it easier for you?
Okay, so you work with it. It's not like it's this day and that's the only day and that's it. Okay.
I think that will vary across the state when you're dealing with the school districts. They do basically just work during school hours. And so I know where I work, we try to work with that family on maybe a lunch hour that they can extend a little bit, or if they have a day off during the week, we will try to accommodate that if possible, but in reality it doesn't always happen.
Right. Well, that's kind of life, I suppose. So, okay. All right. Well, I think you've answered a lot of those questions about eligibility, and I appreciate that. I'm kind of want to move on a little bit to more specific, like what kind of services we can get. So I really like my EI providers. I know a lot of families feel that same way. They they really like their EI providers and would like to continue working with them. Is that possible? Can they work with their EI providers into school system services?
Early intervention providers are subject to being credentialed and enrolled with early intervention. We are mandated to provide those services up until the child turns 3. However, some of those therapists do go on to the education system. It depends if they're also enrolled and working through that system or do it privately, in which case the funding behind early intervention would not be there. It would have to be privately paid, private insurance or whatever other funding sources the family may have. It's also important to remember that from the early intervention perspective, we're there to help that parent learn how to best work with their child, whereas the school district's goal is about the education impact on the child. So maybe helping to understand that difference would help make that decision about the proper therapists involved.
Well, and most of the time it will be different therapists, just in those rare occurrences or when there's an EI therapist who also works in the school district. And I think it's also important to note that unfortunately the parents can't choose the therapist in that school setting. Most of the time therapists are assigned to specific schools or classes or grades. So there isn't a lot of wiggle room with what therapist serves your child.
Do parents get to meet these therapists before they start working with their child?
Oftentimes that happens at that individualized education program meeting, the IEP meeting. Sometimes though, if a child attends a program in a different school, the therapist may be different, and we would try to do everything that we could to hook them up to meet at some point. There's often that rush to get the child going in school, and so it may not occur until after the child has already begun.
I think a lot of these questions that I'm asking is part of it's just based on that fear of letting go. You know, we're established with these folks that we really like working with,
Right.
but now, you know, we're moving on, and it's hard as a parent to do that. But we also know that that's, you know, we want our children to grow, and in order to do that, change has to happen. So, I've heard a lot of different parents have talk about, ooh, I need an individual aide or a prayer professional that comes and works with my child because my child isn't able to do a lot of the things on their own. So is that something that parents can ask for, or how does that work?
That's something that the team talks about again in that IEP meeting. You know, what is it that the paraprofessional would be useful for? And a lot of teams really try to build in natural supports for the student to be successful in the classroom, because you also don't want a child to become dependent on another adult. But sometimes it's very much needed. So those needs would just be discussed, and that would be determined in that IEP meeting, whether a paraprofessional is needed or not.
I have to tell you, when I take families to visit the classrooms, I really like it when we walk in and you can't tell who's the teacher, who might be a paraprofessional in that classroom, or who might be an individual aide. I think all of the professionals in that classroom should be working with all of the children, and so I love it when they can't pick out who might be an individual aide.
That's really the ultimate goal.
Right. It's hard to let go. You know, for a lot of, in my case, I mean, I was home with my son 24/7. I should say more than one child, but my son who went through early intervention and early childhood services. And so, you know, I was used to doing everything. And, you know, so it is hard to think that maybe your child can get by without you. So it's a little letting go issue.
Sure. And from the school district's perspective, we want to be sure that everyone is trained to work with that child. If they have special feeding needs, we want to be sure everyone in that classroom is trained on how to feed that child. If they need special medications, you know, we want that nurse to alert us to the fact that if they have a seizure, this is what you need to do. So everyone in that classroom is trained and knowledgeable.
That was one of my biggest concerns, is that my son had a tube feeding. And how was he going to be able to manage that? Who was going to manage that for him at school? So thanks for bringing that up. Does my child, or do the children who go through the transition and eligibility, do they receive the services at the building where you had the meeting? Where do they receive these? What type of classroom? Where do they go?
Well, it would vary greatly from district to district, whether it's at that building that they receive the evaluation at or not. It just depends on how the district is set up, really. But there are a variety of different service locations as far as settings go. All districts are required to have a full continuum of services. So that means from the most restrictive setting all the way up to, you know, where they would be if they did not have a disability. And that really is the preference. We would love to see students educated with their peers and in that setting. It's called an inclusive environment. But that's something that's determined at the IEP meeting, and again, what the students' needs are and where they would benefit the most.
Okay, all right. So for some children, if parents might feel like their child really doesn't need a classroom setting, but they still might want the services, or still need the services, can their child just receive those special services you mentioned and not get them in a classroom?
That's a good question. It comes up a lot. It really goes back to what the team determines as the educational plan. Remember that the eligibility and the IEP is written based off of that academic impact, and the team decides what that child needs. So once that's determined, you can't necessarily pick what services you want out of that plan. So if a team says, you really need to be in an inclusive preschool environment, then and to have speech therapy services, occupational therapy services, then you can't say, well, we're not going to do the classroom environment, I only want to have the therapy services. Does that make sense?
Yeah, I mean, I suppose if you take out one piece of that puzzle, it kind of affects the whole package, I guess.
Right.
Is that
so we really want to look at that whole child and really work on all of the areas of need and not just certain ones.
Okay, all right. Another question that I know parents have asked me about, and it is a question that I had as well. So when my son was in early intervention, we received physical therapy, occupational therapy, speech therapy, developmental therapy. They came once a week. And those were the complement of services that our team had determined was necessary. Will my child get that same level of service in school?
Again, it just depends on the child and what they qualify for and what the team determines is needed based off of the goals and the evaluation results. So you'll talk about minutes, how many minutes a week each of those services will be. And then you can also talk about where those services will occur at, whether that be the classroom or some other location.
Okay, so minutes might look a little different, location might look a little different. Some have talked about sometimes they get services in group setting. Is that something that happens as well?
Yes, that could be individualized instruction or group setting. In EI, they talk a lot about the naturalistic environment. Once you move over to early childhood special education, it's more of the regular education environment. Again, where those peers would be if your child didn't have a disability. So that should always be discussed first whenever you're talking about the location of the environment and what supports and services can be added in to make the child successful there.
I think the thing that I need to keep remembering and helping families remember is that the focus of the programs are different, and that in early intervention it's the developmental, and in early childhood it's the educational. So that does change things a little bit, right?
It does.
Okay.
And in early intervention, they worked a lot with the parents on working with their children when they weren't in the home. You know, at the school district, you may not get 60 minutes a week of speech, but that teacher is working on speech-related activities while they're in that preschool setting. So it's not like they're losing services. They're actually probably getting more in the long run.
Okay, all right, that's helpful to know. So getting to school, okay, do your children ride the bus? And that's kind of scary for some families if they do.
This is so scary for parents that I work with. It's one of their biggest concerns, but I tell them, and they don't believe me until a week or two until after school has started. It is the highlight of the day for kids to ride that bus. Most of our school buses these days are equipped with the 5-point harness system in the front seats, and that's where our little ones would sit. If not, some preschools use a van to transport, and they would provide a car seat. It depends upon the liability insurance that the district has on what form of security they would use to keep that child in the seat. Some of our preschool buses also employ an aide to be on the bus. Others in our smaller districts may just have a high school student who's very responsible, and they sit up in the front near the younger children, and they're that extra set of eyes and ears and mouth to report to the bus driver if there are any needs that the student may have.
So again, that varies from location to location and student to student. But transportation is discussed in that IEP meeting, just like their academic setting. So if there's modifications or accommodations that are needed on the bus or special transportation, that all is talked about in that meeting as well.
So if the child has a wheelchair or something and how that's secured, those kind of things, okay.
Sure, and I think that's important to bring up, Christy, is that not all preschool programs offer transportation, and not all students are eligible for special transportation. So that is a discussion that you will have at that team meeting on what your child needs and then what is offered through the program.
Okay, all right. Well, I guess for some families, they would still prefer to take their child, but I know when I talk to families, I remember this period of time too, and my son would sit and look out the window and see the bus go by, and so when it was time for school to start, he was ready to start, and he wanted to ride that bus. They do. He falls asleep on the bus. It's kind of fun. What if we've gone through all of these meetings, we've determined eligibility, the team has come up with the plan that is going to meet the child's educational needs, and as a parent, I don't agree with it? What happens then?
At the meeting, you should be given your procedural safeguards, which ultimately is your parent right, your parental rights. If you don't agree with what has been discussed or what has been determined in that meeting, then there's a specific set of, there's a specific process that you follow. The first step would always be, working with the school district and trying to come to an agreement there first. Ultimately, if that doesn't work, then there's additional steps to be taken.
Okay. What if we get through all this process and I decide I'm just not ready for my child to start school? Can I mean, am I obligated, now I've gone through all this, am I obligated to send my child to school, or can I say, I need a break?
Before services start, parents have to sign a consent for services. So if you decide that, you know what, I don't want this, then you would sign that you do not consent for those services. And really, you can even change your mind. You know, if you get into the program and you decide, nope, we shouldn't be doing this yet, you can revoke that consent.
Okay. Kind of a follow-up question to this too, and this comes up a lot when I'm working with families, when I'm talking with families, I guess not working necessarily, but a lot of families, when transition's brought up in early intervention, they don't want to do it because they're not ready. So what would you say to parents who are at that point, you know, when they're trying to decide, do I even go through the process?
In the early intervention perspective, we want to encourage families to take advantage of all the resources they're going to have. We're only with them until their child turns 3, and our goal, obviously, is to have them know all the supports that are out there for their child, who is going to be with them, you know, for how many more years. So we want to make a good relationship start between early intervention and the transition team, so that the families will take advantage of that.
And that kind of goes off of the last question too, about giving consent or revoking consent. It is a parent's right, but all of the research shows that early intervention is key. So I would hate for, you know, those early years to go without any services. And I think a lot of it, like you've mentioned too, is it's just kind of a scary thing to let your child go, but ultimately the services are going to benefit the child.
Well, and I guess it's also maybe an issue of, you know, what you're giving up if you just, you know, if you go through the process, you
Right.
know. So kind of
Right.
a more informed decision. Yeah, okay.
And the more informed the parents are, the better they can make a decision as well. If
Right.
they don't know what a program is, what it's about, what the goals are, what services they provide, it's hard to make an informed decision. And if they go through that process and can walk through those steps and see what options are available, then they can make an informed decision.
All right, well, the next grouping of questions that I have are more special concerns. So they may not apply to every family or every child, but I know that there are some families that have these very specific questions. So the first one is situations where the child maybe doesn't talk. So, you know, how will the parent know what that child has been doing during the day? Because they can't come home and say, hey, well, look what I did. You know.
That is something that needs to be talked about in that IEP meeting again. I feel like we keep saying that, but that IEP meeting is just so important to really talk about all of these details. But the communication system can be established. You know, as the parent, be sure to let the school know what information is important to you, what you would really like to know, and the teacher and all of the providers can talk to you too about, you know, what information they'd like to share. And you can develop a system that works, whether that's an email or a notebook or something to go back and forth to communicate both ways. Because sometimes it's important for the parent to express to the school staff too what's going on. Maybe the child had a rough night or didn't sleep, or, you know, a whole series of things that could happen. It's just important to keep that communication open.
And based upon your child's IEP, they will also receive a quarterly progress note, and that's a little more formal look at the goals they've been working on and how they're making progress towards those goals. That's another form of communication that we have with parents.
I know when my son was younger, we had a notebook because he was nonverbal as well, and we did the exact same thing. As I would write notes like, oh, he didn't sleep at all, you know, have fun today, and they would write back. But one of the side benefits of that is that my husband then would have an opportunity to read that, and when we'd go to grandparents' house, they would dig through and see, well, what's he doing at school, you know? So it was kind of nice to bring everybody in together, and that was something we did talk about, was how are you going to let me know?
I think families have also found it helpful when they are tracking a potential illness with the child. They may be able to look back and say, you know, for 3 days of every week he seems to be a little bit more irritable. I notice that's the days where we've increased a medication, something along those lines, and that's been very helpful. It's almost like a mini diary for the child.
Yeah, when my son started having seizures, we would mark those down in the book so we could have a record of how often are they happening. So that's also, yes, very much. For some children, they might use communication devices. So will the school use those devices that my child currently has, or how will they use those?
I think it's important for the speech therapist to be involved in that, because what you're doing at home should also kind of be the same at school, because if you're doing two completely different systems, that's really going to confuse the child, and it might not benefit him or her. So talk to the speech pathologist. Yes, there's low-tech devices, there's high-tech devices, there's picture communication, there's a whole slew of things that can be used for nonverbal children and trying to elicit that speech.
Okay. So we've talked a little bit about how you're going to communicate with me. We talked a little bit about how my child's going to communicate with staff, but how's my child going to communicate with their peers?
I was actually going to mention that too, with the devices and the picture communication. I love when I go into a classroom and the peers are communicating either through the device or handing pictures. I just love it whenever that that language gets carried over, and it's fun to see.
All right, well, thanks. So the staff then kind of works with everyone to make sure the child can communicate with the rest of the classroom. That's cool.
Right. Part of being in that class is you want the child to be a member of that classroom and to have friends in the classroom, and part of that is socialization. So that should definitely be worked towards.
Cool. I want my child to have fun at school.
Right,
And part of having
right.
fun is being able to enjoy the other kids in the class. So a lot of parents feel that. I mean, I think everybody would feel that way.
Right,
So. Another question that often comes up, because a lot of families are under the impression that your child has to be toilet trained before they can start school.
Yes.
Is that true?
I hear that all the time. The child does not have to be toilet trained to attend a public preschool program. They also do not have to be toilet trained to attend a Head Start program. Some private childcare or preschool programs where you are paying tuition to attend those, they may require that. However, any public preschool or Head Start program, it is not a requirement. That in and of itself is an at-risk factor for children, and so we would work on that in the school system as well.
Okay, all right. So if my child uses diapers or is in maybe process of toilet training, how do they handle diapering and those kind of things at school?
They would have a designated area where the child would be changed. Some programs like them to wear the pull-ups so they can simulate going to the restroom, working on those dressing skills, going when the other kids in the classroom go, but they would have a designated area for that. Oftentimes they'll have the parents send in a package of diapers or wipes, and they'll just keep them in a cubby for them, and then when they run low, the parent can refill that.
Use that notebook as
Yes,
they're running low.
absolutely.
Right.
Rather than sending 2 or 3 diapers in the backpack every day, they would keep a supply handy.
So for my son, he was unable to sit on his own and things like that. So is there like a changing table someplace? And is it private?
Yes, they would provide some privacy. It would either be in a public restroom that other children would use with a stall, or they would have a curtain around an area if it happens to be in a classroom. That will vary district to district across the state. I would just encourage the parents to ask that question when they go visit those preschool programs.
Okay, all right. So here's another unique situation. Some parents have children who have some maybe unique behaviors. They bite, or they like to hit, or they maybe just have some behavior issues that might be a challenge in a classroom. So how does the school deal with that?
Those are very common for any preschool age child, whether they are eligible for special education services or not. Our teachers are so trained and equipped with resources to be able to handle children who may be going through some of those issues on their own. We also have other personnel on that special education team who can come in and do a classroom consult. There's a lot of different methods that we can use to help improve that situation for the child.
And that communication notebook would come in handy there too, because it's great to have the family on board and using, again, the same sort of techniques or same systems at school as they are at home.
Okay, all right, awesome. So kind of a follow-up to this last question is sometimes children have very specific needs. I mentioned my son had seizures, but some kids have peanut allergies or other types of things. What do we as parents need to do to let you know this, and how will you handle these things?
Talk again about that in the IEP meeting, those specific needs. Plans can be developed, asthma plans, allergy plans, seizure plans. What happens if a seizure takes place? What does the team need to do? So you can assign different roles, backup roles. You know, what if the school nurse is out that day? Who then is going to implement this plan? Identify the key players in it, and then also what training needs to happen. There's a section in the IEP that talks about training needs, and you can definitely outline, you know, feeding tube, who needs to be trained on the feeding tube, when does this need to take place, how many people need trained, all of those different type of needs.
In that meeting?
Yes.
Okay.
Yes.
Okay. All right. And you mentioned nurse, so for some of these kiddos, the nurse would be a part of that team as well then, right?
Yes.
Okay.
And they would coordinate with the physician, things like that seizure action plan or the asthma action plan. The doctor would actually prescribe exactly what steps need to be taken, if any medication needs to be administered and when that would need to occur. And it would be all on a written plan that would be posted in the classroom. It will be in the child's IEP. It will be numerous places so that everyone is aware of those children's needs.
And I, as a parent, I have input into that plan.
Absolutely.
Okay. All right. All right. Well, I have one final question, and that is, what can I do, or what can parents do to help make the transition easier? You know, for themselves, for their child, for everyone.
I think the best place to start, obviously, with if the child was at early intervention, is to make sure that open communication is there. Our goal is to help teach that parent all the resources available. We're only going to be with them until the child turns 3. There was these other wonderful professionals here ready. So as long as we can work with that family to understand this is a valuable resource for them, take advantage of that. Their child is going to remain with them even though early intervention is finished. So communicate, be prepared, and understand these great resources are out there for that family.
And you said communicate. I think communication really is the key here, you know, in the transition process. The parents should be open with the school district and really talking about all of those needs. We really can make a better plan for the child. The parents know the children the best, and please share that wealth of information with the school district to make that transition easier and ultimately have your student be more successful.
And I try to tell parents to relax. I know it's a really stressful time for them, but if they can plan something special that first day of school to kind of take their mind off of it, I think that helps. We love their children as much as they do, and we're excited to have them in our classrooms, and it will all go more smoothly if they know who that go-to person is for their child, who's that case manager or preschool teacher they can go to and ask a question at any time. I know as a parent, I oftentimes hesitate to ask questions because I feel like they might sound silly or stupid, but there is no silly question when it comes to sending your child to school. So know who that person is that you feel comfortable with and can ask those questions of.
Okay, and it sounds like knowing what questions, you know, for keeping track of the questions that I do have for all these meetings that we've got to go to, so I don't leave a meeting and say, oh darn, I wish I would have asked that question. So all right.
Jot them down when they come to you. And then also on the Illinois State Board of Education website, there's a questions parents can ask school districts in the transition process. And we've really tried to come up with a lot of different, you know, frequently asked questions, and then some really hitting at more unique needs. Of course, we probably have not hit all of the questions out there, but it might be a good idea to read through those and jog your memory of what questions need to be asked or what things need communicated to the school.
Okay, all right, so go to the State Board's website and the early childhood special education, is that what you
Yes,
said? Okay.
yes,
All right,
yes.
wonderful. Well, I want to thank you all again for your time. You know, I think I can speak on behalf of parents that we really do appreciate all that you do, and I appreciate you saying how much that you care for our children as well. And I think parents really do need to hear that, to know that you have their child's best interest at heart. So thank you for your time, and
Thank you.
You're welcome.
Thanks.
Thank
Yeah,
you.
thank you. Mhm.